My name is Andy Lane. I'm a physician scientist and a leukemia program member at Dana Farber Cancer Institute. Here at ASH 2025, we presented the phase 2 results of the triplet combination of tagraxofusp, venetoclax, and azacitidine, or TAG-AZA-VEN, for patients with blastic plasmacytoid dendritic cell neoplasm. So there's one approved drug for patients with BPCDN called tagraxofusp. It's approved as a single agent infusion given every day for 5 days, once every 21 days. We tested this triplet combination based on data from the laboratory showing that resistance to tagraxofusp can be overcome with the DNA hypomethylating agent azacitidine, and also because patients with BPCDN, their cells are particularly sensitive to venetoclax. And so what we found in this study is that the regimen of the triplet TAG-AZA-VEN was safe. There were no new safety signals different from what we had seen when we'd previously tested this triplet regimen in patients with AML. And in this cohort, which was 27 patients, 16 patients with frontline BPCDN and 11 patients who had had relapsed BPCDN, we found some encouraging results. One was that the response rates were quite high. We had a response rate of over 90% in the frontline patients and over 60% in the relapsed patients. Secondly, we had a very high frequency of patients being able to proceed to an allogeneic stem cell transplant after the therapy, which is our normal goal for patients with BPCDN, given that it's an aggressive leukemia. And so overall, we compared these data to the prior data with single agent tagraxofusp. And in sort of each of those categories that I just talked about, it looked like it was a little bit better. So a little bit better response rate, more patients going to transplant, particularly in the relapsed patients where single-agent tagraxofusp had a much lower response rate and not many patients going to transplant. We saw better numbers here. And finally, some of the particular toxicities of tagraxofusp, namely capillary leak syndrome, which is something that we have to admit patients to the hospital and monitor for in the first cycle. It seemed like it was equivalent or maybe even less with this triplet regimen, possibly because in this regimen we're giving only 3 days of tagraxofusp with ven-aza instead of the 5-day dosing of tagraxofusp. So we're concluding that this is a potential new regimen for patients with BPCDN. And I'll close with one other thing, which we're realizing more in the last few years, that patients with BPCDN often have other prior or concomitant diagnosed heme malignancies, diseases like MDS, CMML, or MPNs. And it's particularly attractive then to add the ven-aza to the tagraxofusp in these patients, because now you're getting drugs that have activity against those other myeloid neoplasms as well as the BPCDN.